Hi there, welcome to the latest episode of my 10-minute moan. And the topic of this 10-minute moan is yet another SNP budget, yet another pile of cash flung at the NHS in Scotland, and undoubtedly yet another reduction in the quality of service it provides for the good people of Scotland. So this is a backdrop of 17 years of failure in Scotland for the SNP. And without even going down a whole route of comparing budgets, performance, etc., there is one piece of information that tells you everything you need to know about the SNP and health. And that is the fact that in the 17 years they've been in power, they've managed to reduce the life expectancy of the people in Scotland. When you consider that, you probably come to the quick conclusion that they're not very good at healthcare. And what they've done this year is they've flung some money at it, hoping that will make it better. And then they'll be able to say, but we invest more per head than anybody else in our healthcare. Possibly, but you don't manage it. And that's the biggest problem. Throw the money at something that you want, it doesn't guarantee success. It guarantees people are happy with their wages. It doesn't guarantee that the industry or the body will run as it should. And after 17 years, you evidently cannot run a health service. So there's a lot of people covered it. And I'm going to use the Spectator for reference, because they pick on some good points about this. NHS Scotland can't go on like this. A very good headline. Another Scottish budget and another dire warning from the spending watchdog Audit Scotland that the National Health Service in Scotland is out of control and heading for disaster, with almost 1/6 of the Scottish population on a waiting list. You getting this? 1/6 of the population waiting to get into hospital. And around 10% of the beds occupied by people who shouldn't be there. Daily horror stories from accident and emergency, the service is long past breaking point. Yet, the NHS is gobbling up 40% of the entire Scottish budget. 40%. According to Audit Scotland's director, Stephen Boyle, with increased staffing and higher pay, the health service is simply unsustainable. That's guys that sort of know how to work things, Audit Scotland. They know how money works. We have known this for years. Audit Scotland's last shock report was only 8 months ago, in 2022, that BMA admitted that in large parts of Scotland, the health service is simply not functioning. Last week, Aberdeen Royal Infirmary started turning patients away. This is a hospital in Scotland. This is one of the wealthiest constituencies in Europe, in the heart of North Sea oil and gas industry. Turning people away. Frightening. The usual stage army of supposed experts were dragged onto Good Morning Scotland to answer the inevitable patsy questions from presenters who seemed to be on autopilot. Clinicians, trade unionists, academics and politicians all wring their hands and bemoan the state of the NHS. Ageing population, bed blocking, efficiency, pandemic, prevention, AI, IT, CTA, all the usual explanations are wheeled out. What none of them seem prepared to admit, except perhaps the BMA, is that the NHS, free at point of need, is no longer sustainable. Audit Scotland states that if nothing changes, spending will rise to 50% of the Scottish budget over the next 50 years. The vast majority of NHS budget goes on staffing, which has risen by 18% since 2019 with no improvement in productivity. The P word privatisation is, of course, off limits, even though the BMA's Ian Kennedy said last year that an all-you-can-eat buffet NHS is no longer possible. But no one is prepared to spell out what that means. This might include charging for certain services like GP appointments, adding free prescriptions for drugs used in the private sector to speed up elective surgery or outsourcing cosmetic treatments like gender reassignment surgery. Just stop doing that, that would save us a few quid. The Scottish Government insists that staff are better paid in Scotland. See, there we go, that's great, which has led to fewer damaging strikes in south of the border. That is true, but while this may appeal the SNP's public sector unions, it spectacularly misses the point. More and more NHS staff are treating fewer and fewer patients. The National Care Service, announced 3 years ago as the greatest innovation in NHS since its creation, was supposed to solve the problem of delayed discharge. At any one time, up to 10% of the beds are occupied by people who are well enough to go home but lack social support. The NCS legislation has now all but collapsed after the cost rose inexorabantly from around 500 million to 2 billion, with local authorities and unions boycotting it. It's almost beginning to feel sorry for the Scottish Government because its critics have no answers either and simply parrot the slogans free at point of need and aren't our doctors and nurses wonderful? Many are, but administration of NHS in Scotland is clearly dysfunctional. Short of getting Elon Musk to pile in and fire half the staff, there seems like little prospect of this bureaucratic behemoth doing anything but continuing to wreck the health of Scots while consuming resources desperately needed for prisons, education, roads, green initiatives and the rest. Tens of thousands of people who pay their taxes are waiting years in agony for routine operations. Or rather they aren't, because the NHS has already been privatised by stealth. The number of Scots paying to have their hips and knees done has increased by 80% since 2019. This is already a two-tier service, where those with money to spare can jump the queue rather than waiting 2 years for an operation. This is shameful. The Scottish political classes know perfectly well what is happening. They'll have seen it already in the dental service, which now routinely turns away NHS patients in favour of those who will pay. This is a state we're in, and none of the Scottish political class are prepared to admit it. They would rather preside over a fantasy NHS where everything is basically working fine than face reality that throwing ever more public money into this broken service is good money after bad. And that's 100% because that's all you hear after them. But we pay our doctors and nurses more. That's another point. Why are you paying them more? Why are you paying anybody more than you have to? And that's the reality of running a country, that we don't have an endless stream of money to come in, so we can't just keep throwing it. And if we were paying our nurses and doctors more, which is, a nice thing to do, and we were getting a national health service that was visibly, value for money, then that is absolutely great. But there's something wrong somewhere where the NHS, who is the biggest driver for our health in the country, and the life expectancy is reduced after 17 years. And I'm quite sure, as I know plenty of them, nurses and doctors in the NHS are good people. Maybe it's the management. Maybe that's where we need to start. Get folk into Holyrood, open the bonnet and have a right good look under there. And if we pop off 20-25% of the highest earners in the NHS, then good luck to them going and finding jobs in the real world. Because that's what I find a lot with people that work in sort of public sector environments. They actually don't know they're living. They're no used to the rigours of working in the private sector, because it is different. And possibly is that one of the reasons why we have sub-practical, inferior health service than what we should have, because the people working in it, especially in the management side, don't know they're living. But I hope we can get decent people into Holyrood in 2026, and enough good people will turn up and do the job needed and make some brave decisions, like sorting out the NHS, because it ain't sorting out itself. And it certainly ain't sorting itself out with SNP, who have had 17 years of trying. And we now have a 6-hour population on waiting lists and 10% of their beds tied up with people who can't leave because of nowhere to put them, because the social care service is knackered. But that'll be the Tories' fault. If you enjoyed the video, get a thumbs up. If you've not already done so, please hit the subscribe and the notification bell. Let me know your comments below. Most importantly, as long as you know one of these people in the Scottish Government, media, or any quangos that want to tell us that the NHS is great because we have less strikes in England. Not you, but
everyone else. Have a great day. Cheerio, bye now.